Hello, testing 1, 2, 3. Welcome back to MedScore Radio. We are going to begin this video, Autoimmunity 3, and we're going to start off where we left off, discussing lupus. And what I'm going to do is to describe a certain phenomenon, and you have to guess what that phenomenon is. This is a triphasic reaction of distal digits to cold or emotion in which the skin color changes from white to blue to red. And of course we're talking about vasoconstriction. This of course is Raynaud's phenomenon. So continuing on, let's discuss some of the renal manifestations of lupus. So remember that 50 to 70% of lupus patients experience renal developments, and can you name the most important of this developments, this trouble that often leads to death from lupus? Of course, the most dangerous of these is glomerulonephritis, where at least 50% of the glomeruli have cellular proliferation. So what happens here is that the capillary beds in the kidney that filter the blood have problems, and this leads to renal failure. And concerning the skin manifestations, name two types of rashes you would see in lupus. The first one, of course, is the butterfly or Mela Rash, and the second, or which is more serious, is the discoid rash, which is stimulated by UV light. But we are not going to see the Mela butterfly or the discoid rash in all of the lupus patients. It basically is in 30 to 40% of patients. So let's talk about the Mela Rash. So as we said, it is a butterfly shaped, and it is a rash over the cheeks and below the eyes, across the bridge of the nose. And what would you call the type of rash if it is flat? Then we would call it macular. And what would we call it if it is raised? Then we would call it papular. Remember that the rashes are made worse by sun exposure. So following with this reasoning, what would you call a rash that is flat and raised if you have both types on the face? Then of course we'd call this maculopapular or maculopapular eruption. So how about discoid lupus? What would we see in discoid lupus? In this case, these are red raised patches with scaling of the overlying skin. And this would be a worse prognosis. Fortunately, this would lead to scarring. Okay, so let's continue with a question. What is the test that is helpful in distinguishing systemic lupus erythematosus from cutaneous lupus? And with this test, with direct immunofluorescence staining, you are looking for IgG and complement depositions. Of course, this is the lupus band test. So this is helpful in distinguishing between the two. Because in SLE, the lupus band test will be positive in both involved and uninvolved skin, whereas with cutaneous lupus, only the involved skin will be positive. So remember that with this, the immunofluorescence of the skin is with the antibody to IgG, and it demonstrates a band-like deposition of immune complexes. So remember, we're talking about a type 3 reaction. For example, this is a type 3 hypersensitivity, and it would show up as bright green at the dermal epidermal junction. So what else would we see? We could see alopecia or hair loss, oral ulcers, and then of course the And regarding the nervous system, it is said that lupus results in nerve problems, brain problems, psychiatric syndromes, and this affects 2/3 of people. So what type of potential nervous system problems may result from lupus? And this would include seizures, nerves, severe depression, even psychosis. And there could be spinal cord involvement. It's rare, and this would only occur when there is a clot formation in a critical vessel that supplies blood to the spinal cord. And before we discuss some of the cardiovasculars, remember that we could see thrombocytopenia or low platelet, and this appears to be mediated by antiplatelet and antiphospholipid antibodies. So let's move on. We're going to talk now about the cardiovascular manifestations. So of the manifestations, what is the most common cardiac of SLE? This would be pericarditis. We might also see myocarditis or Liebman-Sachs endocarditis. Remember, pericarditis, cardiac manifestation, then we have myocarditis, Liebman-Sachs endocarditis with valvular disease, and of course hypertension. Finally, all of these leading to cardiac failure. So let's try to remember these. Myocarditis. The clinical features of lupus myocarditis resembles that of viral myocarditis. Remember that. So what do we call this cardiovascular manifestation where we would see many flat reddish tan vegetation spreading over the mitral valve and chordae? This is Liebman-Sachs endocarditis, and this is not due to infection. Remember that this is an autoimmune disease. Call it is aseptic endocarditis, Liebman-Sachs, because remember that it's not due to infection. So there are many clinical manifestations. So we've named a few. We've talked about arthritis, skin problems, the Mela Rash, fever, fatigue, weight loss, renal problems, glomerulonephritis, central nervous system